Thank you. To ask the Scottish Government what its response is to reports that over 600,000 people are on a hospital waiting list.
Cabinet Secretary.
We have already seen a huge effort by our NHS to clear the backlog caused by the pandemic. The total number of patients waiting more than 2 years for an outpatient appointment was reduced by 60% in 6 months. The majority now of inpatient day case specialities have fewer than 10 patients waiting more than 2 years. We've also progressed significant immediate and long-term solutions to support boards to clear that significant backlog that remains. In addition to the targets introduced last year, the Centre for Sustainable Delivery is supporting boards to maximise their capacity and increase theatre efficiencies. And of course, 4 new treatment centres will open later this year.
Russell.
Thank you. Patients across Scotland agree with Kate Forbes about Humza Yousaf's disastrous handling of Scotland's NHS. Evidence of his incompetence was laid bare in a recent BBC disclosure investigation. But medics say they were banned from speaking to the BBC, and every mainland health board refused the BBC access to hospitals, despite this being routine elsewhere in the UK. Will Mr Yousaf reveal if his government had any involvement in blocking media access to the NHS, and if they did not, in his final days as Health Secretary, will he put an end to this secrecy culture?
I'm not sure if that relates to hospital waiting lists, but I'll invite the Cabinet Secretary to respond.
No, of course, it's politicising the health service. That's what is exactly what I would urge Russell Findlay. What I would urge Russell Findlay to do is take off that tinfoil hat that he wears so often in this chamber. There is no conspiracy. Nobody in government is trying to silence anybody in the health service. In fact, quite the opposite. I've had a number of conversations with our whistle-blowing champions who I encourage to raise concerns directly to management that staff have raised before. And as for incompetence, maybe I should listen to Russell Findlay because he is certainly an expert in that.
And the supplementary, Kenneth Gibbs.